Hi, my name is Dr. Kobernick, and I'm founder and director at the CBT DBT Center. I'll be talking today about building resilience with DBT skills. So DBT skills, within DBT skills, which is one part of DBT. DBT skills are one part of DBT treatment, which is a nuanced and complex treatment, and I've spoken about that on this platform before, so feel free to check out that talk. So within DBT skills, there is a section of skills on building resilience. They're also talked about as ways of reducing vulnerability to emotion mind. Emotion mind is a mindset that we talk about in DBT, where our emotions are in charge, or our mood is kind of setting the stage. Our actions are following whatever our emotions are saying right then in that moment. So we become more vulnerable to getting into our emotion mind plenty of the time. I'm sure you can identify times in your life where you've been more vulnerable to getting into your emotion mind, maybe time around the chagim or time around transitions or changes, like changing from school to summer, or from summer back to structure, or big life changes like getting married or a move. Can also be times where we're more emotionally vulnerable, and then certainly times that are more difficult, such as when there's a loss or something difficult going on, conflict in a relationship. Those are times where we might be more emotionally vulnerable. So those are times we really want to buffer up on these skills. So the skills that I'm talking about are called in DBT the ABC PLEASE skills. And they stand for, because we're really into acronyms in DBT, A stands for accumulating positives. So we can accumulate positives in both the short term and the long term. To accumulate positives in the short term, we want to essentially make sure that pleasant experiences are happening to us every day. Now, pleasant experiences are often happening to us, and when we're more vulnerable, there's a tendency for them to happen less often, and even if they are happening, we're not necessarily emotionally present with them. So what we want to do is make sure that pleasant experiences are happening and make sure that our mindful attention is fully on them. So, for example, maybe I happen to be around during sunset these days in a great spot, and I can make sure to experience that sunset for 5 minutes where I am totally engaged in just watching the sunset. And during that time, I'm fully in the experience of watching the sunset, of it being pleasurable for me, and I'm unmindful of worries or other things going on during that time. So making sure that something pleasant is happening to us every day, intentionally setting that up, putting it in your calendar, making sure it's happening. I think of this as slightly different than self-care. People think of self-care as like manicure, spa day, whatever. This is particularly pleasure. So anything that's going to give you a sense of pleasure, and there are so many ideas of what this could be. It could be something new that you haven't done before or something you're more familiar with. I really encourage shaking it up and getting lots of different ideas going on to be most helpful. So again, but when we're doing it, we're setting up that it's for sure happening. We're putting it into our calendar. We're scheduling it to be part of our lives. And we're also being mindful of it while it's happening. We're fully in the experience of the pleasure, and we are unmindful of other worries going on. This A can also stand for accumulating positives in the long term, which is about identifying our bigger picture values and taking steps every day that align with our values. You can go online and do what's called a values card sort, and that can help you to identify values. I like to encourage people to narrow it down to about 3 to 7 values at a time that you're focused on. Doesn't mean you don't have other values, other things aren't important to you, but definitely to make sure that that we're working with a few top values at a time, and then keeping those on our mind, either by like putting up a list of them near our bed, or keeping it in a notebook or a post-it, and making sure that every day we're doing things that align with our values. So that was our A. B stands for build mastery. So we want to make sure, just like we're making sure that pleasant things are happening daily and things that align with our values are happening daily, we also want to make sure that things that give us a sense of accomplishment are happening daily. So this is going to be different for every person, but it's got to be something that gives you a sense of accomplishment. If it's easy for you, won't give you a sense of accomplishment. If it's impossible for you, it's not going to happen. So we've got to pick something that is in your difficult range in order to give you that sense of accomplishment on a daily basis. So if that's happening, for most of us, that's probably happening to some degree on a regular basis. And when we're more emotionally vulnerable, there's a tendency for that not to be happening. So we want to make sure to put that in. C stands for cope ahead. So cope ahead, I think colloquially is thought of as you see a stressor coming up, plan to be skillful, make a plan of how you're going to handle it. Sounds really nice. Cope ahead can actually be a much more complex and pretty cool skill. Coping ahead can also involve essentially using your imagination to rehearse or to establish a new habit different from your usual one. So I usually give the example of, let's say, from when you're 5 years old, whenever you feel uncomfortable or stressed, you bite your nails. Now you're 16 and you decide enough is enough, this is gross, I don't want to do it anymore, the end, right? How likely is it, very pertinent for LL, how realistic is it that you're going to be able to stop biting your nails? Completely unrealistic. Why? Because there's a path in your brain called stress, bite nails. Stress, bite nails. So wanting to stop is not really enough to make it stop. In order to make it stop, we actually have to also have practice patterns of new behavior. So one way to do this, other than actually doing it, is by using our imagination, which is a pretty cool tool to use. So what we're doing here is deciding how we want to handle it instead. So when I feel stressed, instead of biting my nails, I want to take 3 calm breaths, or I want to hum a tune in my head. And when that's happening, that would be what I would want to happen, but it's kind of unrealistic. So what I'm going to do is I'm going to imagine myself feeling stressed and then imagine myself taking 3 calm breaths. And if I do that regularly, I establish a new pathway in my brain, just like happens when I act differently. Imagining this difference works actually just as well, which is pretty cool. So that's a nice trick to have as part of our reducing vulnerability toolkit. So I actually recommend using that for 2 different situations, 2 different types of situations. Number one is if you have a general stressor coming up, like the chagim. Another is for a pattern behavior. So let's say you've been working on nail biting, let's say. So that will be a pattern behavior that you want to work on changing. And for both of those types of situations, cope ahead can be pretty phenomenal. So that's our ABC. And now we've got please. So please skills are all about reducing vulnerability within our body to impact our emotional vulnerability. So in general, we're more emotionally vulnerable when anything is more vulnerable for us physically. So this can include, as outlined in the please skills, physical illness, that's the PL, exercise, avoiding mood-altering substances, S is for sleep, and the last E is for balanced eating. I might have mixed up which E is for which, but I don't think it actually matters that much. So exercise, balanced eating, sleep, and avoid mood-altering substances, which can include also caffeine and sugar and anything that any substance that impacts how we feel, our mood, and physical illness. So any of those times, if you're feeling physically ill, or you didn't eat well that day, you're going to be more emotionally vulnerable. Now, what's useful about this is, first of all, let's try and keep on top of being on top of physical wellness and taking care of ourselves physically. Number one, that's a great idea. Number two, especially in more vulnerable times. So coming up to the Chagim, it'd be a great idea to, especially if you know that you're going to be heading into bigger meals, trying to set up a plan for taking care of yourself physically, making sure I know for me, on Chagim, sometimes it's hard for me to make sure I drink enough. So to make sure I set myself up to drink right away in the morning, to drink during the afternoon is really important to me. So making sure that physical wellness and vulnerability is being taken care of. I also like to add to think about these really personally. So think about what's important for you. So if on holidays or on Shabbos, you tend to like sleep the whole day and never get any sunlight, and then you tend to feel more down, like that might be something that might be important for you to make sure you're getting more sunlight or more fresh air or more movement in your body, whatever is important for you, but paying attention to that. Also making sure that maybe for other people, this size meal works. For you, it doesn't work. Paying attention to what feels good for your body and setting yourself up for that to be taken care of. I also like to add in, it's not in the please skill, but I do think it's important to talk about hormones also. So hormonal changes and shifts can impact how we feel emotionally, absolutely, and make us absolutely more emotionally vulnerable. Just to be paying attention to that and noticing if there are shifts or changes in our hormones, that's going to impact how we feel, and just paying attention to that. There are things that we can do to support our hormonal health, to be more stable, and to to listen to and respect it better. And paying attention to it is also really valuable and important. There are times in our lives where hormones are going to look different, and this applies to both men and women. And there are times where those things are going to look different, and we pay attention to, we understand how those different times look and feel and how those impact us emotionally can be really important and valuable. So those are the ABC please skills for building resiliency. And I really support people being aware of those and reducing their vulnerability to emotion mind. So now I'm going to answer a couple questions that were sent in. So the first one is, I deal with social anxiety. I did CBT and it helped. I still feel closed up. Will DBT help me more? So that's a great question. People tend to think DBT is like a higher dose CBT. It's absolutely not. They're just different treatments. And lots of people don't need DBT. If social anxiety is truly the problem, and I'm saying that because it could be that maybe you are feeling socially anxious, and I would want to make sure that that's actually the problem we're addressing. Maybe social anxiety is actually in the context of trauma or shame or social skills. If it's any of those, then standard CBT for social anxiety is not going to address those directly. And so you would want to make sure that you're actually hitting the problem. So in any of those cases, DBT might be helpful, but it might not. If it's true social anxiety, I would actually just make sure that I really hit all the points with really good CBT, because a good CBT should address the social anxiety. If a part of it is not really social anxiety, it's maybe something else, then maybe DBT could be appropriate. So DBT is really, really helpful for people who are experiencing their emotions in an intense and kind of out of control way. DBT is a great treatment for helping people to better manage, control, and influence their emotions. So if you feel that your emotions are kind of out of control or are kind of running the show, DBT is probably a great treatment model. If that's not the exact problem, if it's primarily an anxiety problem or primarily a trauma problem, that gets a little bit complicated because trauma can also show up. There obviously can be a trauma, but then also be out of control emotions. So we have to identify that. But meaning whatever the current problem is, there's going to be a different treatment model that's going to hit it best. Actually, the next question here is, how is DBT better than CBT? And I actually don't think that DBT is better than CBT. It's just a different treatment model. And if you're treating somebody with DBT who needs CBT, you're probably, first of all, it's overkill. DBT is a very complex and nuanced treatment, and you probably don't need that much like of a dose. And you're probably not hitting the actual problem. DBT is a different frame that very well addresses a particular problem, but not all problems. People who have a typical depression, or who have multiple clear depressive episodes, or who have a true generalized anxiety disorder or social anxiety or a phobia or OCD, are way better treated with other CBT models. So I would say DBT is actually a type of CBT, and there are many other types of CBT that better address different problems. So going to a clinician who's actually well trained and competent in multiple areas within mental health is usually pretty important, because being competent in one treatment modality is really going to limit you. It's like if you give somebody somebody with a hammer sees everything as a nail, I think is the expression. So if you're seeing everything as a nail, maybe you only have a hammer, and you might need actually a full toolbox in order to actually build a house. So same thing with mental health. You have to actually be able to accurately assess the problem and then competently treat the problem, and people don't come in one size fits all issues. So it's probably not going to be just one thing. So DBT is not better than CBT. DBT is one treatment model that's really great for people who experience their emotions as really out of control. People with other kinds of issues are better treated with other options. What issues are best worked on with DBT? Okay, so that's the next question here. Like I said, people who experience their emotions as out of control or who are experiencing multiple mental health problems. So for example, if they have depression and anxiety and panic attacks and difficulty sleeping, and relationship issues, DBT is probably going to be a better model. If they are experiencing even very severe anxiety, but it's just anxiety, DBT is probably not going to be the right treatment model. Sometimes skills can be a nice addition to treatment because DBT skills are just really well packaged skills. So sometimes that can be a nice addition to treatment, but not the full DBT treatment model, which is a pretty nuanced and complex model. Is DBT a more rigid type of therapy? I would say actually not. Most CBT type of treatments are what we call protocol based. So there's a particular protocol that we're following to deliver the treatment. DBT is actually principle based. So there are certain principles we adhere to rather than a particular protocol. So for example, other treatments might have like in session 1 cover this, in session 2 cover that, sessions 3 to 6 cover this. Whereas in DBT it's much more flexible, and there's really just particular principles we're sticking to. Is the relationship with the therapist more or less important in DBT? It's pretty important in DBT, as opposed to other treatments. The relationship with the therapist is actually quite important in DBT. It's important in DBT. It's important in other treatments. That's a complicated topic, and it is a pretty significant factor in DBT, because a lot of people who are coming to DBT experience interpersonal challenges, and we're relying on the relationship with the therapist to help shape more effective behavior. So that's a pretty important topic. Okay, so that is pretty much all the questions that were submitted, and I hope that was helpful in talking about building resiliency with DBT skills, especially going into a potentially more emotionally vulnerable time, taking care of ourselves and making sure that we build our own emotional resilience and our ability to handle what comes our way is really valuable and important. I find sometimes even like outlining what my plan is for dealing with emotional vulnerability is really valuable. And I'm making kind of like a checklist so that I make sure that every day I'm really hitting all those different points. This way I don't lose it in a time that's more emotional, that's more vulnerable. That's the point, right? I want to make sure that I am, that I'm really hitting all those and making sure that's happening. Okay, hope that's helpful.